We are fueled and back for another healthcare hustle. Nick and Ron and Nick. Today we have another cool topic, as usual. Today is long-term telehealth integration and what that is impacting on the design phase as well as how it's helping patients.
Right, and it's kind of interesting because it wasn't necessarily a programmatic element that we've dealt with in the past.
Right.
You know, I mean, telehealth is relatively new just because of COVID and those needs. So doctors and facility managers are kind of confronted with, like, where do we put this space and, like, what is it exactly?
And finally, telehealth is at the forefront, probably driven just as much by behavioral health needs as well. And it's really fascinating to see how we're integrating it into the process and into the programs.
Right, and I was always kind of confused about how it worked in general because, you know, as I'm talking to a doctor, as I'm talking to you guys, you know, I'm sitting there with you on a screen and I'm trying to figure out how you're diagnosing me, but that's, you know, that's the power of the tool, and we need to maximize the tool and maximize the spaces so that this interaction between patient and you guys is the most helpful that it could be for those people.
Absolutely. So what went from an add-in, almost afterthought? I mean, we're seeing clients ask for special backgrounds now, and not even special rooms, they're even integrated into every exam room because, you know, we always try to be really efficient with spaces, right? And if we can create an exam room that can not only just see the live patients, but if it's empty for 10-15 minutes, you could sneak in a little telehealth call.
Right, and that telehealth call could be with a patient that's very far away in a remote location that wouldn't otherwise be able to get to you and squeeze into that 15 minutes. So it's serving the community in greater ways than we ever really imagined.
Yeah, it's a fascinating process, and I think has, to your point, allowed those folks that have mobility issues, have transportation issues, have child care or elder care services issues, really get the service and the healthcare needs fulfilled.
Absolutely. So reach out to us, leave a comment or a like, you know, ask questions. How can we get this kind of space integrated into where you're working? That's pretty much what this is all about. It's about the dialogue, right?
And our fans are loving it. Keep on coming back. Healthcare Hustle. We're going to see you next time. Thanks.